asbestos in generally in general industry. I'm going over a regulatory overview, a general awareness, as well as discuss some operations and maintenance plans. And it may seem odd to some of you. I know sometimes it's even odd to me that it's 2022. We've known about asbestos and its hazards for many, many decades, and yet here we are, we're still talking about it. But the fact is these are headlines from the last year, many from the last couple of weeks, of how asbestos is still in the forefront of the minds across the nation, and definitely as far as enforcement goes. Our local media agencies are always apt to jump on any chance they can to talk about an asbestos scare, particularly in schools. So what regulations apply when it comes to asbestos? In New York State, we're very highly regulated. We have several federal regulations. We have the state regulation. And then if you're in a local jurisdiction such as New York City, you have your own. I highlighted two here that are going to be the focus of the conversation today. And that's asbestos in general industry regulation from Osha, as well as Industrial Code Rule 56, which is the state regulation. The reason why I'm focusing on these is the other ones that you see have a high level of enforcement. NYSHAP highly regulates building demolition and major renovations. AHIRA in schools, the different factions between the unions that are in schools, the parent-teacher organizations, it puts schools under a microscope. And whenever something's under a microscope, the enforcement action is there. And then if you're operating asbestos in construction or in the shipyard industry, again, if you're working with asbestos, you're highly trained here in New York, and the enforcement is high. And anyone who has the opportunity to work in New York City, you're well aware that the court systems are overloaded with asbestos claims and lawsuits. So there's no shortage of compliance there. It's in general industry and its application of both OSHA and Industrial Code Rule 56 that there's a lack of enforcement, somewhat because of lack of inspectors able to enforce the law when there's so many other industries to enforce, but also in the fact that many people aren't aware of it. And so it becomes a complaint-driven enforcement policy. To go over some of the highlights of the OSHA regulation, again, this is 29 CFR 1910-1001 for asbestos in general industry. It has several requirements for buildings built prior to 1980, basically stating that all employers and building owners must assume that the building materials in their facilities contain flooring, specifically all thermal systems insulation and surfacing materials, which we'll get into what those consist of, and certain flooring products. They must determine what the location is, the presence, its quantity within all the facility and work sites, and inform the employees. Remember, OSHA regulation is for employee protection. So employees must be made aware of where the asbestos is in their facilities, and including any vendors you have coming into your buildings. A lot of us hire outside cleaning services for our office buildings. If any of those activities could disturb the asbestos, then these vendors need to be notified. And last but not least, maintain a record of all of these asbestos products and the asbestos-related activities in your facility. Additionally, we have here in New York State Industrial Code Rule 56, mirrors OSHA requirements, stating that for buildings prior to 1980, you do need a pre-construction survey. If you are going to do any work in your facility that will disturb a material that could potentially be asbestos, you must survey those products, have them tested, and determine if and where asbestos will actually be disturbed. Here in New York, any work disturbing material that could be asbestos or is confirmed must be done by a licensed abatement contractor using certified workers. One caveat to that, if you're the owner of a single family home and you live in that home, you're able to disturb whatever asbestos you want in your own home. However, if you hire a contractor out to do that work, that contractor would have to be aware of the asbestos and be trained and certified as well. So in order to go through what is required as a building owner or building manager or a safety rep representing the owner, I want to go over a brief history of asbestos on what it is and where we can find it. So here's our quick asbestos 101. It's not man-made. It's not something that has been manufactured or invented by humans. It's a naturally occurring mineral that exists on this planet. The forms that we're concerned about for human exposure are the fibrous forms of asbestos, which are listed here, the 6 types here, with chrysotile being underlined as the most common type that we see in our geographic region. It's been touted as the miracle fiber for many of its physical properties. It's resistant to heat, corrosion, fire, chemical reactions. It's biologically resistant. Mold won't grow on it. It has a high tensile strength and it could be woven into various fabrics and liners. It doesn't evaporate, dissolve, and can remain virtually unchanged under many, many conditions. It is very lightweight and therefore it can remain suspended in air and water and be carried long distances by either. Uses of asbestos go back hundreds of thousands of years. It has been found in debris found from the Stone Age. Even in the Roman Empire, it's been found in fabrics woven for table linens. But with modern day uses, the first commercial mine opened in North America around 1887. By 1930, production increased and it became the most popular construction material in the United States. And by 1980, it's been used in over 3,000 commercial products. For example, here we have some asbestos oven mitts where it's been woven into the fiber for its heat resistance and fire resistance. And the next slide is a couple of advertisements over the years, some scenarios that seem funny to us, but it just shows how commonplace asbestos was in our everyday life. We have baby clothes made out of asbestos. You know, the Wizard of Oz, the fake snow used in the movie contained asbestos. All of these show how much it was common and not as feared as it is today. Other places where we see it, vermiculite, another mineral that is common to potting soil. Asbestos is often found around the same deposits that vermiculite comes from. So we may see it in those types of applications, as well as our vehicles. Not only our buildings, we've put it in our vehicles. Brake pads, clutches, and gaskets have all contained asbestos over the years. But the most common use is for construction materials for buildings built prior to 1990. So it's almost easier to say with all of the uses that asbestos was, it's almost easier to start with what doesn't contain asbestos. And it basically comes down to these couple of materials: plastic and rubber, glass, wood, and metal. Almost every other type of composition out there has industrially or commercially known to contain asbestos in its manufacture at some point. Starting with the 3 categories that we classify asbestos-containing materials, we have thermal systems insulation. Again, OSHA requires that your buildings be surveyed for TSI, surfacing materials, and some flooring materials. So TSI is any product that is insulation that is meant to prevent either heat gain or loss from a piece of equipment. This is the material that most people associate with asbestos that we look for in our buildings. Pipe insulation, mud joints, duct insulation, interior components of boilers, water tanks, very commonplace materials. The second type is surfacing materials. These are materials that are typically troweled on or spray applied when they're put into our buildings. And often the asbestos was mixed on site within the matrix of these materials as it's being installed. Some examples: ceiling and wall plaster and spray on fireproofing material. Now, on the last 2 slides, we only saw about 8 different examples of asbestos-containing materials for TSI and surfacing. So everything else that doesn't fall into these categories fall into the very general miscellaneous category. And this is where we're going to find most of our building materials. Things like ceiling tiles, floor tiles, decking materials, cement transite, door insulations, flooring, various kinds of flooring, caulking materials, window glazing, auditorium curtains. The list goes on and on. This is not by any means an exhaustive list, just the most common that we see in everyday office and commercial buildings. So I always bring up with all these products that contain asbestos or could contain asbestos, how many here on the Zoom have performed renovations in their home or have had renovations in their offices prior to, if they've been built prior to 1980? For example, in your home, all of these products are potential sources of asbestos. Everything from the roof on top of your house, the roof gutters could be made of asbestos cement, heat shields for your lighting, your ceiling and wall materials, your floor materials, and then of course the ones that we always think of is the boiler and pipe insulation materials. Similarly, in a industrial or commercial setting, these are the same list of materials that we see in our homes, just more with a commercial or industrial application. Same thing, the roof, the skylight moldings, the skylight caulkings, chimney vents, chimney liners, as well as the interior materials, floor tile, ceiling tile, wall materials. So with all of this said, asbestos is in our environment. It's all around us. We could expect that to a certain degree, everyone on the planet is exposed to some prevailing background level of asbestos, both from naturally occurring sources. Remember, it's a natural mineral, and natural minerals and rocks erode over time, and those asbestos fibers are going to get into the air. Similarly, our manufactured materials, such as brake pads, if you had a asbestos-containing brake pad, every time you step on the brake, a little bit of that brake pad grinds off, and those fibers are released into the air. So there are background levels of asbestos in our environment. So how does this affect us? If asbestos is all around us and it can make you sick, how can it make us sick? And just like any other toxin, it must enter our body. Different toxins enter our body in different ways, whether it be absorption, ingestion, inhalation. And we also need a certain exposure to it, a dose. The picture on here shows a bottle of vodka and a couple of shot glasses. If I have a bottle of vodka on my desk, I don't open it, I can't be exposed to it, I'm not going to get drunk. I have one shot, okay, now I may feel a little bit relaxed, but that's all I have. I'm not going to see any other effects. The effect wears off after an hour or so. But if I start having several over a short period of time, I'm going to feel the effects pretty hard. And if I were to have the entire bottle in a single setting, I'm probably going to need a hospital. Similar with any other toxin, is the more that you're exposed to it, the more of an effect. And it matters whether or not that's a long or short exposure over a short period of time, an acute exposure, versus an exposure that lasts over a long duration, a chronic exposure. And it also matters for the disease that's going to be affected. How long after the exposure does it take for your body to show the effects in the form of a disease or a condition? Specifically for asbestos, the primary route of exposure is inhalation. The way that it affects us is as we breathe it in, some of these fibers bypass our body's natural defenses. It'll get past our nose hairs, past our mucous membranes, past the cilia, and some of those fibers will reach deep down to the deepest parts of our lungs in the alveoli. This is where the air exchange occurs, where oxygen from the air is transferred to our bloodstream and is traded off for the carbon dioxide. As the asbestos fibers get deep down into our lungs, some of these are going to cause a cut in that alveoli. With any cut in your body, it's going to create a scab and a scar. You create enough of these, have enough fibers, make these cuts, and have more scarring. This leads to a condition of asbestosis, where essentially the oxygen carbon dioxide exchange, the efficiency of that for your body is decreased to a specific level that is classified as that asbestosis. And with any other foreign element that enters your body, the cells could deform, resulting in a cancer. And in this case, it would be a lung cancer. A rarer form of cancer that could be caused by asbestos exposure is mesothelioma. It does take a certain amount of time, again, that latency period from the onset of an exposure to when the disease shows itself. And for asbestos, that's about 20 to 30 years, with an increased chance of the onset of disease if you're a smoker, about 60 times increase. So there have been studies. The Agency of Toxic Substances and Disease Registry has measured what is the background ambient exposure for asbestos fibers. They've determined that we breathe about a cubic meter of air in an hour, and that for background asbestos, depending on where you live, what kind of environment, that exposure could be anywhere between 10 fibers to 10,000 fibers an hour. 10 fibers if you're in an outdoor rural area, 10,000 fibers if you have the unfortunate scenario of living next to an asbestos mine. But most of us are in city and suburban areas, and we could expect about 100 fibers in a given hour. And because of all of our air samples, our laboratory data gets reported in fibers per cubic centimeter, that translates to 0.0001 fibers per cc. So again, as far as health-based standards, the risk of asbestos-related disease depends upon the exposure by inhalation, and it is dose-related. Most of the people who have developed asbestos-related diseases are former asbestos workers, because they are being exposed to a lot more fibers on a given day over their lifetime than the average office worker or average employee. And that is that the average airborne levels in buildings, even if they contain asbestos, are so low that the threat to building occupants is therefore also low. There is no set threshold to say that above this level, you will definitely get an asbestos disease. But the studies have shown that the asbestos workers who have developed asbestos-related diseases have been exposed to as high as 5 million fibers per cubic meter of air. So 5 million fibers an hour, or by laboratory terms, 5 fibers per cc. So a couple of decades ago, you could walk up to anybody and ask, hey, do you know anyone who has asbestosis or mesothelioma? And more often than not, you'll find someone who knows a relative, a friend, someone who has contracted some sort of asbestos-related disease. Why don't we have that now to that degree? It's because OSHA's been around for 50 plus years, and they've established regulatory exposure levels for asbestos. And therefore, the onset of diseases have decreased. Specifically, NIOSH and OSHA recommend that they have a limit of 100,000 fibers per cubic meter of air as a time-weighted average, again, translated to a 0.1 fiber per cc. That's the OSHA PEL for asbestos fibers. Living here in New York State, whenever an abatement project is done, whenever a planned disturbance of asbestos occurs, they would set up a containment barrier, and that containment barrier cannot be removed until we meet a air clearance standard of 10,000 fibers an hour, or 0.01 fibers per cc. So significantly less than what the OSHA PEL is, and definitely significantly less than the what the asbestos workers could be exposed to based upon past studies. So I'm going to go into a couple of different EPA regulations that have been established to minimize your exposure to asbestos. I had touched upon NESHAPs earlier. That regulation is to make sure that building demolition and renovation doesn't result in any result of asbestos fibers being released into the air. And keep in mind that the EPA identifies that an asbestos-containing material only when it contains greater than 1% asbestos. For example, if your ceiling tiles contain 1.2% asbestos, you're going to have licensed workers come in, they're going to contain the area, vacate the area, set up all this plastic and remove it as a regulated material. If your ceiling tiles contain 0.75% asbestos, that could be done by a general demo team under any other construction project that you see. It'll look like any other construction project. The EPA has established a ban on any new uses of asbestos. This picture here on the slide is a container of Carnac. This isn't a 50-year-old container that was found in an attic. This was purchased over the summer by a contractor in a private building that needed to waterproof one of their exterior walls. If you look at the lower picture, I don't know if you could see on the slide, but this contains asbestos at a level of about 20 to 30% asbestos. And that was bought over the summer in a large box store, Lowe's or Home Depot. EPA also has a limit on 7 million fibers per liter of water may be present as in drinking water. This may sound like a lot of fibers, but remember that ingestion is not the main concern for exposure to our bodies, it's inhalation. How does it get into the drinking water? Well, where do we get our drinking water from? We get it from groundwater, rivers, lakes. So any area where it has eroded away rock that has asbestos-containing asbestos in it, those fibers are entering the water. Also, the way that we transport a lot of our drinking water in some areas contain our transite cement pipes that transport it from its source in the environment to its distribution system. Those themselves can contain asbestos and introduce fibers to the water. Again, not a likely source of exposure. The main point is that EPA recommends that all building owners and managers implement asbestos operations and maintenance programs. They have the goals of, first, OSHA compliance. There are regulations that apply under that OSHA law that we'll go over, and they've incorporated that into their model program for operations and maintenance programs. They do want to minimize exposure and also manage asbestos in place. Cute little cartoon here just to show that the EPA's concern with asbestos is only when they become airborne and they can be breathed in. And they've recognized that it is better to leave it in place and manage it in place, provided that the asbestos is in a good condition. In other words, removing it has a higher potential of releasing fibers into the air than leaving it in place, provided it's in good condition. If it's not in good condition, you have no choice but to remediate it and therefore removing it. So what are the key elements of an operations and maintenance program? The EPA does have their other regulation governing schools, K through 12 schools, under the AHERA program, where they mandate an asbestos management program. Similarly, they recommend that you model that for your private organization. They first say you should appoint an asbestos program manager. This person needs training. They have to receive a training similar to this, making them aware of the background of asbestos, the health effects, its usage, how to find it in the building. And this person should be responsible to oversee all asbestos-related activities at the facility. They must also have the authority over the people in the facility to ensure that if they tell someone not to proceed with an action, they have that authority to tell them to do it. Typically, this is the facilities manager, and in some cases, it's the health and safety director. Item 2 is perform an initial inspection of the building. How do you know where asbestos is unless you walk around and you inventory all of your building materials? This person should be trained and accredited personnel here in New York State. That person would maintain a New York State Department of Labor asbestos inspector's certificate. And the goal is to establish an inventory of all your building materials. What types are they? Is it a TSI? Is it a surfacing material? Is it a miscellaneous material? Where is it in your facility and at what quantities? Next, you want to assess the condition and the potential for disturbance. There are some materials that you may not need to know that the pipe insulation in your crawl space is definitely asbestos, but the ceiling tiles that the maintenance personnel might be moving on a daily or a weekly basis, that is being disturbed quite often. It may be worth it at that point to collect bulk samples to determine its asbestos content. And I'll digress briefly on the bulk sampling process. Again, here in New York, that person must be trained and accredited to perform bulk samples, that same inspector certificate. The reason being is that there is a chance of releasing fibers by the physical disturbance of collecting these samples. That person should be trained on proper work procedures, as well as how to collect the right number of samples, homogenize it to make sure that those samples are representative of specific areas in the building, to quantify it, make sure that it gets to the correct laboratory who's qualified to analyze those samples, and by the current methodologies. Also on the slide is just a couple of other certificates that may apply when designing or implementing your operations and maintenance plan. A management planner, they are going to dictate which are the best response actions for prioritizing asbestos projects and managing it in place. An air sampling technician, when you do abate asbestos, would be necessary for the regulatory required air samples. And your project designer, who when you decide to perform an abatement, would dictate how, where, why, what the contractor is going to do, and any special handling procedures outside of the regulation. Just some examples of different types of laboratory analysis. So moving on, the next element of an O&M program would be the occupant notifications. OSHA requires that you inform your workers, including outside housekeeping personnel or any maintenance staff, of the locations of asbestos and its quantities. EPA takes it a step further in recommending that any occupant of your building, including tenants and any other outside contractors, also be notified. A couple of things you may want to include is that asbestos does exist inside your facility, and it's maintained in an O&M plan and is periodically inspected. You want to notify them of who the asbestos program manager is and what is the procedure for contacting them if you are doing work in the facility that may disturb building materials that could be asbestos. On the next slide, I'll discuss an example of a work permit program. You must instruct them that no persons are to disturb any ACM materials. And additionally, if they come upon materials that appear damaged, if they come across debris, how to react, how to notify the asbestos program manager, and what are some emergency response actions to take. OSHA requires warning signs in specific areas, and these are areas of the facility where the permissible exposure limit may be exceeded. These aren't going to be your typical office areas. These are your crawl spaces, your basement areas, maybe some areas where the general occupant isn't going to go. The important is that you make them aware of these warning signs and that they know not to go beyond these warning signs at any time. And last but not least, if someone's going to be doing work in your building, they need to know where the location and what's the availability of the O&M plan. How can they protect themselves and not disturb building materials by reviewing the plan themselves. Here's a work maintenance authorization form that I discussed. This is the example provided by the EPA, and it's a very simple form. Little area on top just describing what the work to be performed is, and then a checkbox for the program manager to review the work and say that asbestos materials are not present and won't be disturbed, or to say that asbestos is present but its disturbance is not anticipated. If conditions or the work methodologies should change, direct them to the asbestos program manager. It's a very nice program example for most small facilities. So we have our inventory, we notified our occupants, and we just can't put this program on the shelf and forget about it. We have to come back and re-inspect all of the materials, make sure that they haven't degraded. Any building material, any product has a end of useful life period. So it's important that we periodically revisit these materials to make sure that we're not going to have a fiber release episode. There are no required durations for this based upon OSHA, but EPA does recommend that you follow the AHERA schedule. That schedule is that a re-inspection be performed every 3 years, and that should be done by an accredited inspector. Additionally, a surveillance should be performed every 6 months, and this could be performed by the program manager or custodial or maintenance worker. Someone who's had some awareness training is able to observe what the materials are, be able to identify them, and be able to make a note on its condition. Again, the goal is to make sure that we're prioritizing abatements of materials that could fail soon, not that they have failed and has created a possible exposure. Next is, when you are going to disturb asbestos, what are the job site controls? What are your company's procedures and policies for making sure that that is done right? Here in New York State, that is very simple. Most companies do not keep asbestos abatement workers on staff. So in most cases, this is going to always be done by an outside contractor. Again, here in New York, any disturbance of an asbestos material must be performed by a licensed abatement firm using certified supervisors and handlers and workers. Most often, air monitoring is required on these projects in accordance with Code Rule 56. That air monitoring must be performed independent from the abatement contractor. So the air monitoring firm cannot be the same entity as the abatement firm. And that firm must be licensed and must use certified project monitors and air sampling technicians. And a best practice for your O&M plan is to identify who these people are before you do a project. It's always good to have these numbers on hand, have a relationship with these firms in the event of an emergency. You don't want to be searching Google for an accredited abatement firm when your building's on fire. And that's what I mean by emergency situations. It can be something as catastrophic as a hurricane came to town, and now your boiler room is underwater and you need to get your building back online as soon as possible. This may have impacted asbestos materials. Having a consultant or an abatement contractor on call to assess and assist you through this would be most helpful ahead of time. Similarly, pipe breaks, fires, any sort of catastrophic event. And it doesn't have to be catastrophic. It could simply be a loading delivery truck backed into your building and cause some damage. Maybe a very small area, but to have people on hand would definitely be useful ahead of time. And last but not least is the record keeping. OSHA requires that any asbestos related activity in a building you own be kept for the duration of your ownership. And not only that, but that these records should be transferred to any successive owners. So if you sell the building, you should be handing over these records to the new owner so they have the knowledge of everything that you've maintained over the years. And what are some examples of records? We have your initial inspection reports, assessment reports, all training records for any program managers, your custodial staff, the O&M plan, any amendments, your re-inspection reports, any laboratory reports. Abatement reports are very important, as well as the waste manifests that you are going to receive from the contractor. Really, any asbestos related activity should be kept in an organized manner within your O&M plan. Because if and when a complaint comes across your table, and OSHA or the Department of Labor is coming down on an enforcement action, having this information to show that you're doing your due diligence is very, very useful to have that in an organized way. And the question that I normally get at this phase is, Ed, at the beginning of the presentation, you mentioned how OSHA is, in general industry, is probably the least enforced. So why do I have to do this? I've been in my building, I've been in my facility for 20, 30 years, and it's never been a problem. Well, I'm gonna leave you with the quote from a wise person that says, it is not a problem until it's a problem. It's then that you will wish that you had treated it like a problem. And simply that, no one's ever thinking that an employee is going to make a complaint or an outside contractor is going to make a complaint. So I can't say that you will definitely be audited or visited by OSHA or the EPA or the Department of Labor. But in the event that you do, and you don't have these things in order, it is almost 100% guarantee that some enforcement action is going to be placed against you. So it's better to be prepared ahead of time. And if there's any questions or comments, or if you're looking for more information, some useful resources is the EPA, of course. They have handy information for owners and managers of buildings. OSHA, there's a regulation where we're all familiar with reading regulations. That goes over exactly what's required. And here in New York State, again, the Asbestos Control Bureau through the Department of Labor is also a great resource. So at that point, I'd happy to entertain any questions, or if there's a question that you can't think of now, you think of later, feel free to send me an email. I'd be happy to discuss any of these items further.
All right, thank you, Ed. Yeah, thanks for taking the time to present to the group.
No problem.
Yeah, I'd like to open it up for Q&A. If anyone does have a question, feel free to unmute or type a question into the chat. I can start things off. So you kind of pricked my ears up a little bit when you mentioned the vermiculite and potting soil, because I started a COVID garden 2 years ago. So you mentioned like that. I know there's also a lawsuit right now towards Johnson & Johnson for the talc powder that has asbestos in it that they've known about for a few years. So what about this ban on new use? Why doesn't something like that apply to these products?
The reason being is that it's not specifically used in its manufacture, from what I understand, and it's not a new use. Vermiculite's been used in potting soil. Talc has been used as a body product for a very long period of time. It's from what I understand with those lawsuits, it's a matter of were they knowingly distributing their product, knowing that it contained asbestos and not reporting it, not disclosing that. Okay,
so just incidental exposure that isn't really covered in there if it accidentally has it.
Right. For instance, same thing with vermiculite. Talc is mined like any other mineral, and anytime you're digging into the earth, there's a potential for that asbestos mineral to be present.
Now, is there a high potential for exposure in something like potting soil? Is there any guidance from, say, the EPA on whether you should wear masks when you're wearing, or?
There's no specific guidance that I'm aware of here in New York. If you come across loose vermiculite in, say, as part of a building demo, we see vermiculite as an insulating material above ceilings or as wall fill. New York State has dictated that the removal of loose vermiculite is always treated as an asbestos-containing material. The reason being is that the lab analysis can't always find the accurate amount of asbestos that's embedded with it.
Okay, thanks, Ed. We have a question in the chat I can read out for you. So what precautions can you take when renovating your home, knowing that asbestos may be present in some of the old materials?
The precautions you could take are certainly to test and find out whether or not it does in fact contain asbestos. For instance, New York is one of the few states in the nation that regulate asbestos in what's called non-friable materials such as floor tile. So I myself, I would have no issue in my own home removing asbestos-containing floor tile. You may want to do things like ventilate the area, maybe have a air filter on hand, use some water during the removal to keep the dust down, and not pulverize the tile, take it up in as whole pieces as possible. Any friable material, if I had asbestos plaster or pipe insulation in my home, I would definitely test it before doing any work to it. And if it is asbestos, I'd hire a professional.
Okay, thank you. Anybody else have any questions before we close things out? All right, well, Ed, thanks again for your time. We appreciate you calling in.
Thank you for having me.
All right, thank you, Ed. Thanks, everyone.
Thanks. Take care.